Okay, so welcome everyone to the United Nations Association Marin County Chapter United Nations Sustainable Development Goal number 3, good health and well-being for all. Again, I'm Felicia Chavez, and I am happy to welcome you all to our virtual event. Just like everyone else, our events have gone virtual. And before I hand it off to our hosts, our MCs for today, Bryson and Zoe, who are also fellow board members, I just wanted to let you know about a sort of a resource in process that we've been working on in the background here called sdgmarin.org, which is a draft of a website. It's kind of a SketchUp or a mock-up. And I'm going to share my screen so you can see it now. If you type sdgmarin.org into any web browser, it will redirect you to a page on my day job, my Systems Thinking Marin website. And when you scroll down the page, some of these goals are now clickable. So we've had events for each of these first 3 goals, today being the 3rd, good health and well-being. So if you click on, for example, number 3, good health and well-being, as of today, I just made this page live. You'll be able to scroll down and the video of today's event will be here, will be posted here. And then some details about health and well-being in Marin County will be available here. So I don't have any videos currently, but I do have a few reports you could link to. So if you click on these links, they'll open mostly PDF reports in separate tabs, one database, and I don't have any books in here currently. And then also the targets. So each of the Sustainable Development Goals has a list of targets underneath it, and I've posted those here on the Global tab. And then down here will be a few examples of organizations that are doing work in this particular space. And finally, a link to the website of the United Nations that will give you more details about this particular Sustainable Development Goal from the global perspective. So with that, I will hand it off to Bryson and Zoe.
Hey guys, so my name is Zoe and I'll be one of your MCs today. I am the secretary here at the board. Bryson.
Hi, and I'm Bryson. I'm also a member of the board. I recently joined earlier this year. And yeah, we're emceeing the event today. And I'll give it off to Zoe to start it off.
All right, so I'm so excited to have you guys here. I think it's going to be a very enjoyable event. So I'm going to give you guys a brief intro to SDG 3 and Marin. So basically, ensuring healthy lives and promoting well-being at all ages is essential to sustainable development. And currently, the world is facing a huge health crisis like no other. COVID-19 is spreading human suffering, destabilizing the global economy, and upsetting millions of lives around the globe. So the United Nations Development Program has highlighted huge disparities in countries' ability to cope and recover from the crisis. These disparities and ability to cope and recover with the crisis aren't only present within country to country, but also within our own borders and in fact within our own county. However, it is also important to take a step back and know that these disparities are a symptom of a bigger issue within our county. The disparity in the ability to access basic health and achieve physical and mental well-being. So that's basically kind of like a little spiel about what we'll be talking today. Felicia, I believe you're going to introduce our next speaker.
Yes, thank you. So I'm very happy to introduce Paul Clarke. Paul is going to share with us today the global perspective on United Nations Sustainable Development Goal number 3, good health and well-being. So let me just read you Paul's short bio here. Paul Clarke leads institution building, security sector reform, and combating terrorism projects for the U.S. government programs with partner nations in Africa. Previously, he organized seminars to combat organized crime and combat violent extremism overseas. He is a retired Air Force officer and served on the National Security Council staff as the Assistant Press Secretary for Foreign Affairs at the White House under administrations of both parties. He is a member of the board of Marin UNA chapter. He worked in Guinea during the 2013 to 16 West Africa Ebola crisis. So Paul, I will hand it off to you.
Great, thank you so much, and I appreciate the introduction. I will share some slides with you. Hopefully those are coming across well. And of course, we're talking about SDG number 3. And, we've gone through, as Felicia said, the first 2, and I think it will be worthwhile to go back and see those videos when they get posted. As for this SDG, so I'm speaking about, I have a tangential relationship. I can't claim to have worked for the UN, but I've worked a great deal with UN organizations in the field. So I'd like to talk about that in the context of speaking about this SDG number 3. And of course, the SDGs, it's the second set of 15-year goals that the international community has set, the first from 2000 to 2015, and then the SDGs now run to 2030. That circle is those 17 goals and 169 targets. And the member states, that is the states being a nation like the US, all agreed to these goals and to work toward these targets. And so if you look into that, there are several targets in these goals for the overall objective of ensuring healthy lives and promote well-being. And there are 13, but I'm not going to mention them all here. We could spend 20 minutes going through the list, but I highlighted the first 8 because it shows the span of issues that this really important SDG covers. So if you go down this list, it's maternal mortality, preventing diseases for children, ending epidemics of AIDS, tuberculosis, and malaria, etc. And these are issues that I come into contact quite a bit in my work. Promoting mental health and well-being. Now there's a new concept the last 15 years for the WHO. Substance abuse, traffic accidents, a very big issue. I'll talk a few minutes about my experience in Guinea, and our interpreter was one of 2 neurosurgeons who'd been trained in Guinea. And his colleague died in a motorcycle accident, was not wearing a helmet, by the way. It shows you the fragility of these things, but it's a very real issue. And then 7 is the access to sexual and reproductive health services. And then achieving universal healthcare. It's a different than the context of our discussion, but it is an important objective to get universal healthcare. So these are the objectives. They're pretty ambitious. So how does this really happen? How does this all work out? The fact of the matter is, it's the member states themselves that do the work. The first set of goals, were very successful from 2000 to 2015, but much of it was the fact that China and India had so much advance, and a lot of other countries didn't. So how does it work to get these things done? And it's really about the member states have to do the work themselves. But the states who are well positioned to assist have done a lot to assist these countries to do this. So it's really each country doing its own thing, supported by organizations that are promoted through the UN. I'm going to show this next slide. I should probably be punished for showing this eyewash of a slide. So it's close to a war crime. So I'm not asking you to read it. I'm just asking you to note the 2 red boxes I have put on there. Felicia, you'll love this. The United Nations is a system. It's not a single entity. There's no world government. And what it does is there are UN bodies, particularly on the left side of the screen. But the fact they're in the UN is a collection of organizations, many of which were not created by the UN. And it brings together organizations that are not part of the UN system also. But there are within the UN system, in the red box in the middle there on the right, is several organizations you've heard of, like the World Food Program and World Bank, IMF, and the World Health Organization. So the point of that I'm trying to make is this big effort being done by all these nations. And really, it's mostly residing in an organization called the WHO, have you heard of, the World Health Organization. So I'd like to spend a couple minutes talking about this really important organization. I've not worked for the WHO, but I've certainly seen them show up in the work that I do, mostly in Africa. And the WHO is a specialized, independent, autonomous organization. They have their own constitution, and it's sponsored by the UN. Created actually the germ of the concept came about during the San Francisco Conference of 1945, and it was founded in 48. But if you look at its goal, it's very much in line with the goal number 3, to attain by all people the highest possible level of health. And it does this by doing several minor functions. One, it's a minor function that they do in about 1,200 categories, making it a big function. But they monitor the health elements going around the world, common trends like obesity levels or signs of epidemic emerging, et cetera, et cetera. So they're a big data center. And then they coordinate responses to health emergencies, which is what most people would think of them. And how they do this, they provide technicians and technical assistance to countries, and they set international health standards and guidelines, which are really important when you're thinking about a Western physician going to do a 2-year stint in Bangladesh or in Australia, for that matter, having a common terminology and understanding of health standards. And of course, they do a lot of work with data. Now, on top of this, the WHO has looked at the challenges of its mission, and it sees a lot of issues that are really important to think about in the common era. And number one they're thinking about right now is climate issues, and something that never appeared a decade and a half ago in discussions about health. But those of us who live in Marin and Sonoma know that changes to climate can have impact on health. I look at all of us who are now buying air filters for our houses, which we never had to do. And then the whole issue of how to operate providing health in conflict and crisis. So my whole career has been about security issues. We are actually in a state of pretty low conflict in the world. There are terrible conflicts, so Yemen, for example, but the relatively low conflict. But boy, we have a big crisis in the form of COVID, and that affects all the health outcomes. So very prescient. They want to make healthcare fairer. There's a lot of injustice in the delivery of healthcare. Infectious disease, preparing for epidemics, and then number 8, investing in the people who do our health. It's a huge topic right now because of COVID, but boy, it's a real challenge in much of the world to get those people pay that they deserve and to keep them in localities where they grew up so they have healthcare in those places. Adolescent safety and earning public trust. Now, this is a really important issue. This was written before COVID. There's a real challenge for the WHO to execute its mission because there's a lot of resistance to, for example, having inoculations being provided to children by some foreigner who shows up in their village or someone from the big city. So it's a really big issue. It's a really interesting way that they've addressed these concerns. Okay, so what is the challenge? That's their big challenge. My challenge as an outside observer is the funding they have. You look on the left side, you can see they get 25% of their budget from when you become a member. And by the way, the U.S. is no longer a member, right? You're an assessed contribution, but most of it comes from voluntary contributions from states, like the U.S. used to give a lot of money and probably will again. And number 2 was the Bill and Melinda Gates Foundation as a contributor. And if you look on the right side there, you look at their budget, about $6 billion for the current year. That's half the budget for the city of San Francisco. So how do they achieve this kind of work they want to do with a budget of $6 billion? Well, a lot of it is just a matter of coordinating with the different entities around the world, states, UN agencies, and global funds like the Gates Foundation, and other health initiatives. So on the in the green there is or state entities like the FID is the former the British Aid Department, and the CDC, of course, is U.S. And on the blue on the right is all these UN organizations. And then there's a lot of other players out there that they coordinate with. This is typical of a lot of UN organizations. What they do is coordinate responses rather than providing delivery of a lot of what they do. We had Katherine Johnson speak about the World Food Program. It actually provides the foodstuffs. But what the WHO does is a lot of coordination and understanding the threat and trying to get a response that's useful. So let me talk a little bit about my experience. As Felicia noted, I've done work in Africa for about a decade. I live in Marin, and I go to Africa for 2 or 3 weeks at a time, every a month or so, and not currently. And one of the projects I was working on was this project in Guinea. And in Guinea, Sierra Leone, and Liberia were involved in some terrible, terrible civil wars in the 1990s and 2000s, particularly Sierra Leone and Liberia. And in 2009, Guinea, the military dictatorship there, marched a bunch of people into a stadium and massacred them. And the international community really did not want to see another civil war. And they went in there and they persuaded the leadership to go. And they set in a democratization process. And it's called security sector reform to try to get the cops and the military to do what their function is. And that's how I ended up working there. And I was happily going along doing my work when the Ebola crisis struck, and that changed our mission somewhat. And I'll talk about that in a bit, but let's talk about the way that UN responded through the WHO. They did exactly what they do in these sort of situations. They provided technicians and technical support and set up field offices to do treatment and contact tracing. And they provide a lot of supplies, again, donated special from donors who were not, who previous to the conflict had not had this on their radar, but were asked for the money and came up with the money for these kind of supplies. And the impact is really significant. On the left side, they brought in epidemiologists to work on a contract tracing program, which we still don't have in the US, by the way, for COVID, not an effective one. And very important for Ebola. And they went from doing 4 contacts per person to almost 70. They did a lot of training around the world, and they prepared other countries to deal with this crisis. In fact, I went to the country of Guinea-Bissau, which is one of the poorest countries in the world, right next to Guinea. And they had me check in with them every 8 hours. And I would speak to the one, I'm sure, epidemiologist in the country, letting her know that I wasn't feeling sick, even though I'd been in Guinea. So it had some impact. And of course, they helped with the vaccination. From my experience, I did see it as a global effort. The place where I was working was Conakry. It's a capital of Guinea, there in the dark blue. The atmosphere changed because suddenly there were hundreds of people coming in from overseas to do this work. Europeans and Asians and Latin Americans, I mean, just the whole world stepped on the doorstep there to help. And in fact, the U.S. gave $5 billion. A lot of that ended up being used in the U.S., but $5 billion to help this program. The Center for Disease Control helped, the USAID, even the Department of Defense did some healthcare. And so we did this, but in the same time, we had a lot of hysteria in the U.S. About the potential for Ebola to come and take root in the U.S. So the way I saw it was that the WHO was the steady hand of having had done this many, many times. In fact, they quickly turned around a vaccine which is currently in use, and the crisis was essentially over. But it did get a lot of the WHO did get a lot of criticism because they were slow to recognize this as a crisis. The first case was in 2013, and it was really 2014 before it became a significant threat. And in fact, if you look at the COVID response, it's the same sort of threat they've been getting for COVID, that they were slow to identify the challenge and slow to respond. And I think that's probably true. And I think that's part of the nature of an underfunded organization whose goal is reliant upon powerful member states like the US. And when we're not cooperating, it makes it hard for them to do their jobs. But if you go on their site right now, you can see their tracker they have with all the data about COVID. I'm not going to say too much more about COVID because of maybe you've heard it all. I'm tracking close to 3 minutes there, Felicia. So I also want to recognize a couple other things that are really important in my mind. One of the most important things the UN has done overall was to eradicate smallpox, and it was in human history one of the most deadly diseases. And in fact, we've been fighting it for centuries. The Chinese came up with a form of inoculation, and we had our own vaccination program. But even then, killed 300 million people in the 20th century. And what happened was, in the middle of the Cold War, the Soviet Union proposed an eradication program, and the West responded. And we went around all of our nations, which were very hostile to each other, and we stamped this disease out in 20 years. And in fact, we were able to get rid of the need to vaccinate people because there's no more disease. And in fact, of course, that's what we think about the vaccination programs is a big part of what they do. They're very focused on ensuring that particularly kids get the vaccinations they need so we can get rid of these diseases. And we've come very close to do that for polio. We've also, continued to move along with the times. We've seen that family planning came on the agenda in the 90s. And then as the world adopted the Western diet, we had cardiovascular issues and cancers and diabetes and tobacco, all things that were taken on by the WHO. And then the environment at the 1992 Rio Summit. I was there, by the way, working for George H.W. Bush, the dad, not the son, and then AIDS. And we were actually WHO was more progressive in its response to AIDS than our own government, unfortunately. Okay, so I'm just about done. I just want to leave you with this thought, and this is a slide about us, because we're going to talk about us in a minute. And what this is at the x-axis is at the bottom is per capita spending on healthcare, and you can see the U.S. The pretty colorful 50 states. We spend twice as much on average than most other advanced states. However, if you look under the other axis, the y-axis, our most clear identifier for success in healthcare is, how long you live. And we are in the realm of 77 to 78, even though we spend twice as much as other states, or peer states, and they are in the realm of 80 to 84. And it's because we don't have a coordinated health system like a lot of countries do. And the WHO is trying to help the world create a coordinated healthcare system. So I applaud their work. Anyway, we'll have a chance for a Q&A, but that is my take on WHO and SDG 3. Thank you.
I'd like to invite people to unmute if you'd like to applaud for Paul or use your little reaction icons. Great. Thanks so much. And as just a reminder, we'll have a Q&A after our next speaker. So please move forward with introducing our next speaker. I can't remember if that's Bryson or Zoe.
That would be me. So thank you so much, Paul. That was very insightful. I had not realized how coordinated, I guess, the WHO was, not only with different nonprofits, but also within different countries. It's really interesting. So now it is my honor to introduce our next speaker. So Elaini earned her master's in public health from Boston University and has over 1 decade of experience in community-based participatory research and education programs, both nationally and internationally. Her work focuses on health disparities and disruptive innovation strategies to address them. She has been forming active community partnerships to disseminate information, raise awareness about health disparities, and support healthy living in communities of color, specifically through addressing social determinants of health. She collaborates closely with a wide group of advocates and health professionals to create community-driven health solutions that are intentional and support community leadership. So, Elaini, now it's up to you.
Hi, so I'm gonna try and share my screen, so bear with me. Hi, everyone, and thank you for this opportunity. For the local perspective on good health and well-being for all by 2030, I will be sharing health from the perspective of public health and health equity. With that in mind, I want to start out with a vision for public health that the Institutes of Medicine articulated a couple of decades ago that said, public health is what we as a society do collectively to assure the conditions in which people can be healthy. Now, I am sure by now, most of you may have heard the term your zip code equals your health. This is the result of research which has demonstrated that a person's health is determined by a variety of factors beyond healthcare. Usually these factors are known as social determinants of health, and they include most of what you see listed on the slide, right? Our social and physical environment, housing, health behaviors, employment, etc. And it's really the sum total of these factors that determines our health and well-being, right? And so these are really the conditions that we should collectively aim our focus on to achieve our health goals. We can, further zoom in to find out what has the greatest impact on our health. And again, research shows us that 3/4, or the vast majority of our health outcome, is determined by the social and environmental factors within which we live, within which we work and play. And that healthcare accounts for a much smaller portion of our overall health and well-being. So the unfortunate thing is, we also know that our health expenditure does not match our knowledge of what impacts our health. As you see, we spend close to 90% on medical, clinical services, although we know that only about 20% of our health outcomes are dependent on clinical or medical care. On the other hand, we spend a meager 4% on prevention strategies that support healthy behaviors, although now with research, we know that they have the highest impact on our healthcare. So now let's switch gears a little bit and take that closer look locally at Marin. There are many things to be proud of, right? Marin has been ranked the healthiest county in California for the past decade. And I believe it was only ranked second once during that time, right? So this is really great. But, the unfortunate thing is that not everyone enjoys these health benefits. Black, brown, and low-income communities suffer disproportionate rates of health inequity, right? In addition to this, we in the rankings, we ranked near the bottom for income inequality. And we know that income inequality is associated with disparities in education, housing, employment, health and life expectancies, the very things that have the highest impact on our health outcomes. So when we take a deeper dive and look at Black and Brown communities and concentrated areas of poverty in Marin, like Marin City and the Canal area, and we compare them with their neighbors in Ross a few miles away, the existing inequities are clear, right? So as you look at this slide, you know, where our health matters the most, as we know from research, you know, things such as healthy eating and active living opportunities, home ownership, income inequality, employment, we see major inequities that culminate in life expectancy differences that exceed a decade. So, you know, we can also look at that comparison with the Canal San Rafael neighborhood. And one note to make as we look at this slide is that this data includes the Canal and parts of San Rafael. So it's a little bit skewed. The unemployment and obesity rates that we see may look better because they include data for more affluent surrounding areas. Also, the other thing is we know that immigrant communities usually bring with them healthy behaviors that support their health outcomes initially, but these gains usually dissipate within a few years. Now, looking further, we also know that food insecurity impacts around 20% or 1 in 5 folks in Marin. And this is further exacerbated by the high cost of living, and you know, just makes food really difficult to afford for families, right? Now, you know, for most of us that live, you know, these numbers are a reality, but you know, for most of us that live here in Marin, we know that we are in a county where the best, most plentiful, and healthiest foods are abundant. The unfortunate thing is that they are not available or accessible to all, right? You know, we looked a little bit, you know, above in the comparisons around housing inequities, but we, you know, just want to give it another look, a deeper look, and we see that inequities in housing are also severe in Marin County, right? You know, historical and many times government-sanctioned discriminatory housing policies contributed to the current situation, right? So housing, because of its historical implications and really its large impact on our health, deserves a higher focus and intervention. And, you know, as you look at this slide, you know, just think about, you know, the number of, the percentage of renters in Marin City and Canal, and, you know, the percentage of renters in Ross. And, you know, as you translate it, that what this means is, you know, home ownership is really high in Ross, whereas in the other communities it isn't. The other thing is to look at, you know, the last row, and even the second row to where it shows us the kind of housing stock that exists in these 3 communities. The last row, we see that, you know, housing has been built for many more generations and has existed with its associated benefits, mainly in the Ross area rather than the other 2 neighborhoods. So as many of you probably already know, in the US, homeownership is our largest asset, right? It not only boosts a family's current financial stability and ability, it also secures our children's and grandchildren's future. It offers shelter, it funds schools and other community assets through tax revenue. You know, it attracts and makes accessible businesses and amenities that further support those communities, right? So the benefits of housing, especially in terms of health, are highly impactful, and they are multi-layered, right? We just name a few things here, but house ownership really has many benefits. And beyond that, it spans generations, right? And that's an important point. So strategies to expand this asset among communities historically and intentionally excluded from this benefit through things like redlining, other discriminatory policies is essential because of its overall impact on our health outcomes. I just want to recommend, if you want to learn more about these housing policies, is to check out Richard Rothstein's book, The Color of Law. It's really a great book to find out more about these housing policies. So check it out. Okay, finally, earlier we saw disparities in adult overweight and obesity rates when we did the comparison between communities, but we also know that low-income youth disproportionately bear the burden of being overweight or obese. This is especially troubling because research also tells us that these early challenges put kids at a higher risk of becoming overweight or obese adults. This higher risk comes with an increased risk for heart disease, type 2 diabetes, and cancer. And that, in turn, just extends the poor health outcomes over their lifespans. The other thing is health inequity costs, and it costs us a lot, right? In Marin, an assessment found that the cost of preventable health conditions and its resulting loss in productivity costs us $229 million a year. Now, we can always use these monies. These monies could be better put to use by focusing our health expenditures on social determinants of health, which we know have the greatest impact on our health outcomes. So, I want to just say that it's not all doom and gloom, right? The great news, the good news is that research clearly demonstrates that social determinants of health are preventable. And we have ample evidence, ample public health evidence that shows unequivocally that prevention pays. So as you look at the slide, research has shown that investing a really small amount in prevention, that ounce of prevention, really yields big results. And, when they did this calculation, this return on investment, it only represented the medical cost savings only. And so it didn't include the significant gains that we could achieve in worker productivity, reduced absenteeism, work and school, and enhanced quality of life. So that is, really hopeful, right? And we also could look at a couple of examples that showcase effective public health strategies and how they played a major role in improving our collective health, right? One is the adoption of stricter air quality rules, which used Clean Air Act programs to lower pollutant levels, which implemented emission reductions and clean gasoline standards, which then translated in greatly improving the air we breathe and is very supportive of our overall health, right? Another really well-known, probably most people know this, and effective public health win is the significant reduction in tobacco use in the US, right? We know tobacco use plummeted from almost half the US population smoking about 50 years ago to less than 20% smoking around 2014. And what was successful public health strategies were combined strategies. They included education, they included limiting access, and they included pricing and price increases. Of course, we know about vaping, so we know that recently some of these gains have been eroded, but regardless of that, this campaign and its results really remain a remarkable win for public health. So now let's kind of finish or end up by discussing what we can do. You know, as we saw, main factors that impact our health are the social and environmental aspects of our lives. And I keep repeating it, but I think it's really important that we are clear about that. It's things like housing, employment, income inequality, healthy eating, and active living opportunities. So now that we know this, if we want to achieve health equity and ensure the goal of good health for all, we need to realign our health expenditure towards prevention strategies, which we know will yield a more effective return on our investment, right? In addition, our strategy will need to include a collective impact approach. And this approach has to center around community leadership and voice, right? We need to look at and employ policy systems and environmental changes so that we can sustainably and long-term transform Black and Brown communities, mainly that are currently and have historically been impacted by health inequity. And the other really very important thing is that we have to have a commitment and put in place the safeguards to ensure that, when we do make these changes in the communities that have been highly affected, that, the commitment and the safeguards are in place to ensure that the main beneficiaries of this change will be those that have been, greatly impacted, that is Black and Brown and low-income communities, right? We also need to engage and create effective cross-cultural collaborations, right? One siloed group or program cannot effectively address this. As we saw, what mostly affects our health is beyond the healthcare institution. What mostly impacts our health is our social and environmental reality, right? So, we have to have a matching and inclusive strategy if we want to move closer to our goal of health for all, right? So we really need to focus on bringing together usual and unusual partners in housing, transportation, healthcare, public health, businesses, banks, and definitely at the center of this has to be community, right? So that we can all work together. The great thing right now is that we have ample examples of effective roadmaps to achieve health equity. So we can learn from this, we can adapt from this, and we can, create our own roadmap to achieve our goal of healthcare for all. So finally, I, want to highlight the importance of community leadership, right? For communities that have been marginalized intentionally and unintentionally and are suffering health inequities currently and historically, it is critical to have community leadership as a central part of any of our interventions, right? We should be prepared to engage and provide space and support for such leadership to flourish, and have to make it an integral part of addressing health inequities, right? It's important for us to listen. It's important for us to promote community visioned interventions. And it's really important for us because we have a lot of resources, is to share our expertise and resources so that we can all make informed decisions, right? And transparency in all our interactions is really central and essential. So, as I shared, there are ample examples of organizations and tools on how to create a roadmap to achieve health equity. And one of the leaders in this arena is Changelab Solutions. And this brief video, has an overview. It's just an excellent overview of how we should work together to achieve our goal of health equity and health equity and health for all, right? I also want to mention another local leader in this arena, which is a California endowment that has actually done extensive health equity work throughout California. So if you're interested in learning more on these subjects, these two organizations have extensive research and materials and tools that you can utilize. So please check out their websites to learn more. So again, thank you all for allowing me the space today.
I'd like to invite everyone to unmute your line to applaud for Elaini. And handing it back to you, Bryson.
Yeah, thank you so much, Elaini. That was very insightful. So now, after both of our speakers have given their presentations, I would like to spend 15 minutes to talk a little bit about your guys' questions that came up from their presentations and maybe get a little discussion going. So if anyone has any questions for the speakers, feel free to speak up.
And also, Elaini, if you could stop share on your screen. Thanks.
I have a question. Paul, do you see any trends that moving forward that might indicate, who's or the UN's shift in priorities? So say, mental health emerging internationally, or as we know now, infectious disease, or just the spread of communicable diseases. So just curious about a sense of trends of some things being more important and versus others.
Yeah, I think there's two things to think about. The COVID, we tend to fix problems we just experienced. We look back. So they will spend, likely we'll do in the U.S., looking at our system of responding to crises. I think that's something that they're going to be spending a lot of time on, and I think that's well considered. The other thing that they're going to be working on is the concern about climate refugees and the health effects. And this is already a discussion within the UN. You hear about what happens when you have sea rise in a place like Bangladesh, where it's a big population and not much land. And that will cause a lot of disruption to healthcare and inoculations and physical effects. So I think those are two issues.
Oh, I'm curious to know, and it was a great perspective to have a sense of the $6 billion budget that you mentioned, that the WHO is half of the budget of the city of San Francisco. I guess my question is, if there is additional funding needed, is the WHO ever allowed to take funding from, let's say, I know there's a lot of other organizations that are working on what they call the billionaire strategy and trying to convince some of the billionaires to support that. Do you know if they have the ability to accept that type of funding or not?
Yeah, yes. In fact, as of a year ago, the second biggest donor was the Bill and Melinda Gates Foundation. Okay. And then when there's a crisis like the Ebola crisis, they do what the UN does a lot of, which is going around with a cup and asking for money for a crisis. Same thing with security problems. There's no UN army, thank God. But when they do have a need for security, they have to go around and ask for it. Same thing with crisis response.
I have one question that I can think of right now. So in terms of, I guess, our community in Marin, would you say that, what would you say would be the number one priority right now in terms of achieving the goals for SDG number 3? like, would it be obesity, or is it like maybe income inequality, or I guess maybe obviously COVID-19 might probably be the biggest one right now. But I just wanted to see what your opinion was on that.
You're right. Right now, I think COVID-19 kind of subsumes and kind of overrides everything else. But I would say really, I think we really have to think about it in terms of looking at the bigger picture. When we kind of take away one piece of it and we say, okay, let's just talk about obesity, then what that does is, because, you know, when you really kind of look at the big picture of obesity, obesity is because you probably, you know, don't have all the conditions that you really need to not be obese, right? And what is that? Behind that is definitely income inequality, definitely housing, definitely, you know, having, you know, fresh fruit and vegetable in your neighborhood, definitely having safe neighborhoods, right? Places to work out, places to exercise, places to be out in the open. So I think we really need to start thinking about not stop gaps, but really the bigger picture of really how are we gonna make the difference that we need to make. And just looking at obesity, Bryson, if all of those other pieces have to come into place, then we really have to push for not just a grocery store, but also for, you know, families having livable wages. Because if they don't have livable wages, having a grocery store will not do you any good, right?
Yeah, being healthy is expensive, so not everyone has the luxury of doing that, which is unfortunate.
I have a question. What systems do you have for engaging communities?
So is that question for me or?
Oh, yes, I think so, or whoever.
Yes, so systems of engaging community. So we have a variety of ways in which we can engage community, right? One is really just going into the community and understanding what the trusted government and non-government organizations that are in place, right? The schools, you know, your local city council, and there's many community organizations in place within a community. So for example, let's just talk about Marin City and the Canal. If you think about Marin City, some of the well-known established organizations are the school there, there's a clinic, there's the local government, which is unincorporated, the community services district. There are local churches there. All of these are really trusted organizations. So if you wanted to engage with community, you would find out the times where people meet. You would go and introduce yourself, sit down, listen to, you know, what the needs are in the community, and then really follow the lead of what community says to you, right? If they say, really, right now, what we need is, let's say, grocery store, for example. If you have the wherewithal to make that happen, then you could start by talking to them and bringing that information to them. Same thing with the Canal neighborhood, right? There's Canal Alliance. There is the Multicultural Institute. There is Parent Services, PSP, a variety of organizations. Yeah, I can't remember all of them, but there's a variety of organizations also in the Canal neighborhood where you could just go to those meetings, introduce yourself, and people are very welcoming, truly, in these communities. Find out what they need and engage in that way. The other way to do it is also at the county level, right? You could go to you know, the meetings that the board of the board of supervisors has, and if you have, you know, connections there, you could facilitate those conversations. So I would say these are some ways in which to engage community.
Have there been any neighborhood town meetings where you can get the people themselves involved?
There's always neighborhood meetings in both communities, you know, like I said, these organizations, you could reach out to them, find out when they meet, find out when they have events. And there's several monthly meetings, you know, quarterly meetings. Yeah, so it's a matter of maybe going into the communities and finding out and then engaging with them.
All right, well, thank you.
I have a quick question, spinning off that a little bit for Elaini. So as an individual, what do you say, for example, is the number one thing we can do to help in Marin County? Like, for example, I understand if you're a nutritionist, you could volunteer your services, or if you have no people to open a grocery store, sway that, I see how that can be. But if you're, for example, just your average individual, what would you recommend we do?
And so again, I would really say this would be an individual endeavor, right? Really going and knowing the community and finding out what they need. And then I think we all have a variety of connections. We have community connections, we have family connections, we have, you know, we all have a variety of connections and resources. So I would say go to a community meeting. Right now, most of these meetings are virtual. Find out, you know, the needs of community, ask, and then really actively listen, and then go back and, you know, I think you could listen and find out what they need and see what you can offer, right? So for example, if you have a connection, let's say if someone says, yeah, we need, I don't know, expertise in, let's say, gardening techniques. And maybe you have a connection with a local farmer or a local grocer or something like that. You could make that connection to say, well, you know, I do have this resource and I could give you the connection with that resource, and here it is. Another thing could be that you might have the expertise and experience, and you could say, you know what, I have a few things I know that I could share with you. How can I do that? The other thing is also advocacy, right? So if, for example, definitely in the Canal and in Marin City, housing is an issue, right? And, you know, housing policy is an issue. So advocating at a level of, on a larger scale, or finding out information or supporting initiatives that are happening in these areas is also a possibility. So I would say, you know, the first step would be to go and find out about the community and really understand your resources and how you can connect folks to resources. But you do have to go in and connect and listen and find out. And, you know, it's also important to know when you can just listen and support. And if you don't have resources and you can't, but you can understand and really be connected, that's also important, right? You don't always have to do something. It's good to do something, but sometimes it's also very important to understand what your neighbors are experiencing and engage with that. So I would say, I think everybody would have a you know, potential for engagement.
Thank you so much. That's very insightful, and I'm already getting a few ideas. Thank you.
Okay.
Bryson, I had a quick comment and a question.
Yeah, of course, yeah.
Just to slip in real quick. Paul, I just wanted to comment based on your presentation, the really helpful graph with the US way off to the right in terms of expenditure, but not so high up in terms of life expectancy and health outcomes. But also I was really struck by the WHO constitutional goal of the attainment by all people of the highest possible level of health. I was like, wow, that's really inspiring.
Yeah, well, it's also quite vague, but if you look at those SDGs, and I did a little disservice because I didn't give the full goal. They're very specific, a timeline, and decrease morbidity by 17% by 2030. So yeah, it's quite broad, but it really does fit so well with that SDG, and if there is any kind of global organization working towards health, that's a pretty good objective for that. And, it's a great value. So thank you for noting that.
And I know I'm pushing our timeline a little bit, but I wanted to slip in one last question for Elaini, which was, Elaini, you really focused on this importance of community leadership. And I just wanted to get a sense of Marin County currently, like if 0 is no community leadership happening and 10 is like the picture of the ideal community of amazing community leadership happening and it's working really well and health disparities have been closed 100%, like just at kind of a gut level, where is Marin at on my imaginary scale?
That's a very good question, Felicia. And I would say, you're right there with me in community. So you probably could answer this question as well as I could. I think community within community has a lot of leadership. I think the issue is translating that into the larger, not only translating, but connecting it and kind of making that leadership real in arenas outside of the local level, right? So you know as well as I do, for example, in Marin City, the level of community leadership is high, right? Community leads and implements a lot of, they're in the decision-making process within Marin City. I would say the same within the canal, right? Within institutions such as Canal Alliance or Parent Services Project, the Multicultural Institute. In places such as those, community leadership is appreciated and celebrated and given the space to flourish. The difficulty is that without the interconnectedness with the bigger county setting, the full what is the word I'm looking for? It would be so much bigger, and the threads of interconnectedness, and also not only the value, but it translating into success for what we're trying to do would be so much more if it was at that higher level, right? So I would say, I don't think I can give it a number, but I think there are differences in which it is really high, and then maybe it doesn't go beyond that.
Thank you. And let me just point out too, I'm going to bring back up the SDG Marin page because I'm noticing that some of what Elaini is sharing, for example, if you had some research you were doing for work or school, you can find a link to where some of this information is documented on the SDG Marin #3 page. So for example, under reports, a portrait of Marin County Human Development Report from 2012. That's a commonly cited one that I've seen in Marin County, where it specifically documents the, like, for example, life expectancy difference between Marin City and Ross. And they talk about that in the beginning in I think it's called the key findings section. So that's one example. And then under databases, there's this county health rankings for Marin County. And there you'll find that Marin County typically comes out #1 in health outcomes out of 58 counties. But it's when you go into the details that you start to see disparities between ethnic groups, neighborhoods, income, and those granular details like that.
Okay, cool. I think those are all the questions. And I guess, yeah, thank you so much for asking these really good questions. And that was really insightful. I think for right now, we're going to move on to a Kahoot quiz. I feel like most of you who've been on our previous SDG meetings know what a Kahoot is. Is there anyone who does not know or who has not done a Kahoot quiz before? Okay, there's some
possible. Also, it would be fabulous if both Paul and Elaini's information was fantastic. If there's a way that the presentations would be available, maybe on the UNA Marin website or whatever method works best for all of you.
Yeah.
It's great information.
Right, yeah, so we're recording this whole SDG meeting, and we're going to post that on the SDG, or on the Marin UNA website in the SDG #3, I guess, website on the UNA website. I think Felicia will get to that at the end of the meeting.
Yes, and we'll send out an update as well to the participants.
Yeah.
Thank you.
Okay, cool. But anyways, I'll create the Kahoot quiz. It's a really short quiz. It's only 5 questions, but it'll help get the blood flowing. I know you guys all have been sitting here for the past hour, so it'll be a good little mix up, and maybe it'll help get your blood flowing, get your brain flowing a little bit. So give me 1 second. And how this works is that it's kind of like a multiple choice quiz where it's a little bit interactive and it plays some really weird music. But you have a certain amount of time to answer these 5 questions. And to join the quiz, you will have to join, or I guess instructions are on my page right now, but you have to join www.kahoot.it. And from there, you enter the game pin, which is 5005918. And I guess you guys could all see that on your screen if it's sharing properly. But let me know if you guys have any questions. I'll wait a couple minutes for all of you guys to join, and from there we'll get started. We got Felicia on, first person. Yeah, but yeah, let me know if you guys are having any trouble.
I don't know how to get onto that.
Do you have an iPhone?
No, I don't.
Okay. Could you open a new window on your browser on the internet, and then you just go to www.kahoot.it.
I don't know that I can. Just go ahead. Okay. I'll just watch.
You could answer using.
I'm too old for this electronic world.
You could answer in your head, and if you get the right answer,
all right,
celebrate. Okay, we got 1, 2, 3. We got 6 people so far. I'll wait maybe a minute or 2 more, and then we'll get started. Yeah, and I guess these questions are going to be pretty standard general stuff about good health and well-being. Nothing too tricky or anything, but they're just some fun facts. So anyways. Okay, 1 minute. I'll start at 4:25. Last chance.
I also sent the link to the Kahoot in the chat, so perhaps if you guys would like, you could also click on it there and then put the pin that it's on the top once it gives you to the website.
Thank you, Zoe. That's a great idea. I should have thought of that. Okay. Is anyone trying to get on? Let me know really. If not, I will start it in about 20 seconds. Okay. Okay, gonna start it. Here we go. First question. What is SDG number 3? Is it gender equality, clean water and sanitation, good health and well-being, or sustainable life on Mars? You have 8 seconds left to choose the correct answer. Hey, one person was a little too ambitious. Sustainable life on Mars is not an SDG yet, but most of you were correct. Good health and well-being. Good job. Ooh, Zoe's in first place. Oh yeah, and I forgot to mention, the faster you answer, the more points you get. And overall, that adds up to who gets the most points in the end and wins the Kahoot. But if you get it wrong, you get 0 points, obviously. Okay, question number 2. How often do 30 to 70-year-olds die prematurely from non-communicable diseases, which are usually like cancer, diabetes, cardiovascular disease, and what's the other one? I guess the other one is like tuberculosis, I guess, like those type of lung diseases. Oh, nice. Only one person got it once every 2 seconds. Yeah, which is pretty crazy. People die I guess those are the leading causes of death, not only in the US, but also in the world. So yeah, one person dies every 2 seconds from these types of non-communicable diseases. So it's a big problem in the world, and hopefully technology and medicine can help that. Okay. Oh, wow, Zoe's killing it. Good job, Zoe. Question number 3, how many lives has COVID-19 taken globally so far? 1.9 million, 650,000, 9.6 million, or 28.6 million? Ooh, answers are spread all around the place, but the correct answer is 1.9 million. I guess the majority got it correct compared to the rest of the answers, but yeah, that was a tough one. 1.9 million so far have died from COVID-19, which is really bad. So make sure you remember to wear a mask and stay safe, socially distance. Oh, Lily, nice. Taking over Zoe on the Kahoot. Okay, what percentage of adults suffer from obesity in the United States? I guess Elaine talked a little about that in Marin County. However, in Marin County, or I guess in her presentation, she took into account overweightness as well. Obesity is a little different from overweightness, as obesity is a little bit worse of a condition, more extreme. But yeah, 40% of adults in the US suffer from obesity in the US. So yeah, one of the main issues in the United States today. So yeah, just eating healthier and just having a more equitable and I guess more equal incomes, and a declination in poverty might help that a lot. Okay, last question. This one is a trick question. How can you promote good health and well-being in your community? Ooh, nice. Yeah, most of you guys chose wearing a mask. I guess overall that one has the most immediate effect considering we're in the COVID-19 pandemic, but all of the answers were correct. So you guys are all right, unless you guys didn't answer that question. But Paul got 3rd place, bronze medal, 2nd place, Harpreet. Wow, very nice. And in 1st place, drum roll, Zoe. Wow. Zoe's the MC though, so she should be disqualified, but good job, Zoe. Anyways, thank you for taking this fun Kahoot quiz. I'll give it up to Felicia to give up the concluding remarks and wrap up our SDG meeting number 3. I'm not sure how to exit screen share. Oh, there, stop share. There we go.
Great. Well, thanks so much, Bryson. I'm always amazed at how fun the Kahoot quiz actually is.
It's really surprising. I feel like it's a really simple idea, but they're surprisingly really fun, and I don't know, changes it up. So I enjoy it too. I hope you guys all did as well.
So thank you everybody for joining us today. Just as a reminder, we are a membership-driven organization. So if you are not currently a paid, or if you're 25 or younger, a free member officially of the United Nations Association, you can join. Go to unamarin.org and click on the join information button. You can also stay on this call. I am going to, if it's okay with you, Bonnie, I'm going to hand the host function to you so that if anybody is interested to ask questions after the official call, they can stay on. Would you be available, Bonnie, for about 5 minutes to answer any potential questions?
Yes.
Okay, great. So if anybody wants to ask questions about your membership or get some clarity about what that would actually mean, we're also always interested in board membership. It's a great opportunity to exercise your leadership skills. And then also as a reminder, we will be posting the video from today's presentation on our website, and we'll try to send out a follow-up email to all the participants from today. So thanks everyone. And again, if you have questions, feel free to stay on the line, and Bonnie, our membership chair, thank you, Bonnie, can help you to answer them. And if she can't answer them, we'll make a group effort to get you those answers eventually. Thanks so much, everybody, and enjoy the rest of your Saturday.
Thank you.
Thank you. Good to see you,
Thank you
Gail.
so much.
Thank you. Well done.
Yeah.
Thanks for coming out.